number of cases at this point in the last 24 hours alone, we've seen a huge spike in the number of cases. But we've highlighted here on India Today how it's important to maintain two things. While we're looking at the number of cases, what we also need to be looking at is how the country is faring as far as the fatality rate goes, as far as the recovery rate also goes. And we've compiled some data. Our data intelligence unit has put forth some numbers that shows that India is faring better when compared to other countries. When you compare how many cases we have versus the number of deaths, India seems to be doing well. Let's first show you this particular graph about the state-wise fatality rate. Now, West Bengal has the highest fatality rate at 9.57. We have compiled states based on the number of cases and the number of deaths that they've reported. So West Bengal has the highest. That's followed by Madhya Pradesh. Now, in fact, these are in fact states which have a high case fatality rate, while you have the likes of Maharashtra, for example, which has so many cases, maximum cases in the country, and their fatality rate is in fact at 3.85. Similarly, you look at Delhi, you look at Tamil Nadu, both states also which have a lot of cases of coronavirus, but the mortality rate, the fatality rate is still under control. So let's break that down further with regards to how many tests are conducted and what exactly the fatality rate is. West Bengal is right up there. I want to focus first on this corner of the graph. You see the likes of Delhi and Tamil Nadu here because they're conducting a lot more tests, which means that when you actually compare the number of tests versus the fatality rate, that percentage comes down. It is for states like West Bengal and Madhya Pradesh, Gujarat also, which is very worrying because it means that they're not doing enough tests, and at the same time their fatality rate is high. So West Bengal, Madhya Pradesh, Gujarat, these are states that are showing very, very worrying numbers. Besides that, we've broken it down further for you to explain how states really are faring. You look at this with regards to the number of cases versus the number of deaths. Maharashtra right up there. There's a reason why Maharashtra is the worst affected state. It's got a huge number of deaths and a huge number of cases as well. But you look at, for example, some of the numbers here. Now, I want you to also focus on the fact that Madhya Pradesh, and you look at Rajasthan as well. Now, Madhya Pradesh has lesser cases, but yet you've got it having a higher fatality rate. That by itself is worrying. And there are so many states like that. West Bengal, for example, has lesser cases than that of Uttar Pradesh. In fact, half the cases that Uttar Pradesh has is in West Bengal, and yet it's got a higher fatality rate. As I said earlier, what states will have to focus on is not just ensuring that they contain the spread of coronavirus, but also in ensuring a better recovery rate and lower mortality rate at this point. Unfortunately, some states have been not so successful in doing that, and that is something that the government, the centre, has also been highlighting. Let's also get you the latest from Maharashtra. Very, very worrying numbers at this point that's coming in from the state. In the last 5 days, as you can see, there's been a number of cases, over 1,000 single-day spike that's been reported since May 6th. On May 6th, 1,233 cases were reported. May 7th, that increased to 1,362. You come to May 8th, it did come down slightly to 1,089, then went up again to 1,165. Today, in the last 24 hours, the single largest spike has been reported with 1,943 cases. This is a cause of worry for the state of Maharashtra. Many, many cases that are still coming to light in the state. However, if you look at how they fared when compared to other states in the fatality rate, they do seem to have that under control. But because of the kind of testing and the huge number of cases that are coming to light, their death toll is still relatively high.